How do HPV vaccines reduce transmission risk? Imagine a powerful shield that helps prevent a virus from spreading in the first place. That's essentially what the human papillomavirus vaccine does. It works by training the immune system to recognize and fight off specific types of HPV, the virus responsible for many cancers and genital warts. When someone gets vaccinated, their body produces antibodies that can latch onto the virus if they encounter it later. This prevents the virus from establishing an infection in the genital area, which is the first step in transmission. Vaccinated individuals tend to have lower levels of the virus if they do get infected. This means they carry less of the virus, reducing the chance they will pass it on during sexual contact. Think of it like lowering the amount of a contagious substance that can be spread. This reduction in viral load makes transmission less likely, especially during intimate activities. Research shows that when women are vaccinated, the risk of passing HPV to their male partners drops significantly. This is true even if vaccination happens after sexual activity has started. It highlights how vaccination doesn't just protect the individual but also benefits their partners and the wider community. When more people get vaccinated, the overall amount of HPV circulating in the population decreases. This phenomenon, called herd immunity, makes it harder for the virus to find new hosts and spread further. Some HPV vaccines also offer partial protection against related HPV types not directly included in the vaccine. This cross-protection adds an extra layer of defense, further reducing the chances of transmission. Timing is important too. Getting vaccinated before becoming sexually active provides the best protection because the immune response is stronger, and the risk of initial infection is lower. Completing the full series of doses, which is usually 2 or 3 depending on age, ensures maximum effectiveness. By preventing persistent infections with high-risk HPV types, vaccines also lower the risk of developing HPV-related cancers, such as cervical, penile, and anal cancers. This is crucial because these cancers often develop from ongoing infections that could have been prevented by vaccination. In summary, HPV vaccines reduce transmission risk by preventing infection, lowering the amount of virus in infected people, protecting sexual partners, and helping to build community-wide immunity. This approach not only cuts down the spread of the virus but also decreases the incidence of HPV-related cancers. For anyone considering vaccination, it's always best to discuss with a healthcare professional to understand the most suitable timing and schedule. Following these guidelines helps protect individual health and contributes to the broader effort to control HPV transmission worldwide.